Hi, everyone, colleagues, ladies and gentlemen. Thank you for joining this, I believe, the last session of the day. My name is Nader Lessan. I'm a consultant endocrinologist at Imperial College London Diabetes Centre in Abu Dhabi. And I've been asked to talk about time in range and Ramadan fasting. I'd like to thank Dr. Mohammed Hassanein for inviting me and the organizers. So I will also be presenting the TIR time in range survey reported on behalf of my colleagues, friends, Dr. Mohammed Hassanein, Dr. Bashar Afandi, and also myself. I have no conflict of interest to report. I'll be talking about CGM, metrics, time in different ranges, and I'll be taking you through the questions on time in range survey by TIR in two parts. I'll be alluding to some relevant previous studies. When we talk about time in range, we talk about data generated by CGM by and large, and those are the two commoner devices used certainly in the UAE, but there are many devices in the market and they all generate similar reports because that's supposed to be standardized. So I put the reports from these two particular devices, and there at the top you can see the ambulatory glucose profile from Freestyle Libre on the left and from Dexcom G6 on the right. And you can also see some of the other report pages from the two devices, and they are standardized and fairly similar. So how is the AGP put together? You get a lot of data when you use CGM, use daily traces, you have several time points per day. This is one day, then second day, third day, and so on and so forth. They put together to generate one hypothetical 24-hour period worth of data, such as this one. This is called the ambulatory glucose profile. And it is from the ambulatory glucose profile that we take the time in range, TIR, there in the middle between the two green lines. Here, 70 to 180 set arbitrarily, but it can be different for different patients. But that's the one that is applicable to most of our patients with diabetes. We also have time below range, and that comes at two different levels. But here we have below 70 as time below range and time above range above 180. And that can also be two different specific ranges. And this is what we get. There are thresholds or time above range, time in range, and time below range. And the one applicable for most patients with type 1 and type 2 diabetes has been defined and accepted, here published in Diabetes Care 2019. But the question is, do these apply to our patients during the course of Ramadan fasting, or should they be different in any way? And in particular, time below range, should it be different, given the fact that during the fasting hours, we don't have the liberty of breaking the fast with hypoglycemia? Should it be different? And what about time above range? Should it be different than time in range? So glucose metrics in Ramadan, who should be using these metrics for? Should be using CGM and the metrics for patients on insulin only, or patients on sulfonylurea as well? And what should the targets be? Should we be having different targets for fasting during the daytime and eating hours? Should they be different? What about time in range, time above range, and time below range? And these are some of the questions that Dr. Bashar Afandi, myself, and Dr. Mohammed Hassanein were posing and thought are worth discussing. So with that, the survey took shape and was sent to a few hundred colleagues. I don't know exactly how many received it, but we received a good number of replies and responses within a short period of time. I think it was only about 48 to 72 hours, and decided that we're going to talk about this in the meeting today. So we've got 115 in total, This is the date when the survey was created. Now, these are questions, some of the relevant questions from the survey. First, region of residence for respondents. So out of 115 people, about 40% were in GCC countries, 14.8% in the rest of the Middle East, and we also had patients, we had respondents rather, from Southeast Asia as well, and Sub-Saharan Africa and Europe. Specialty, 75% of the respondents were endocrinologists. We also had internal medicine physicians and primary care physicians. Type of practice, most were in public sector, some private, and some both. Majority, more than 50%, were in practice for more than 20 years. Question was, in the practice, how many patients, what percentage of patients were using CGM to control glycemia during Ramadan? And less than 25% of patients, the response of 65% of the physicians said less than 25%. So the number of people are using CGM during Ramadan to control the glycemia is less than 25% in the, it seems, in the vast majority of the practices. And we had 25 to 50% in 19% of the responders, 50 to 75% in 11.4% of the responders, and more than 75% in about 4% of the responders. Still a good number. Okay. Should glycemic metrics guide advice on whether patients should fast during Ramadan? 46.7% of respondents thought yes for patients on insulin. For patients on insulin. So a lot of the respondents thought that for patients on insulin, this would be useful. 38% of respondents thought for all patients it can be useful and should be used to guide the Ramadan fasting. And we had some people who were neutral and some people who did not, so said no. So just to put things in perspective, this is one of the studies that our group did some years earlier. So the top line, the blue line, these are, first of all, these are different medication groups. And the top line are people who are on insulin. So what you see is that people who are on insulin, they did much worse compared to the others, and their iftar time hyperglycemia was more exaggerated. So the control was worse during Ramadan. And then after that, you have people on sulfonylureas, and at the bottom, you have people who are on insulin, or not on insulin, they are on the diet plus minus metformin. So here, the message is that people who are on insulin, they need more attention, and this is what a majority of our responders thought would be the group to concentrate on. So this question, is there enough evidence to establish standardized glycemic metrics for Ramadan fasting? 22.8% of respondents thought yes, agreed. 41%, 42% nearly had neutral, and 35% disagreed. Now let's see, is there any evidence that to help us use and generate metrics or decide on metrics for Ramadan fasting? I looked this up, and if you search on Medline for CGM and Ramadan, you find 19 studies on Medline. There probably are a lot more, and some very familiar names here. Muhammad Hassanain, of course. We have Dr. Walid Kaplan, you have Dr. Bashar Afandi, we had the Dr. Asad Khalil, and others. So there are some papers there, and it might be an idea try and do meta-analysis on this and see what we can get out of the studies that have been done. And there are studies, including studies on Ramadan fasting from Dr. Ali Bernard, Dr. Salim Bishaya, who's probably almost certainly in the audience. And our group have done a number of studies, and this is one of them. From our data, we thought that Ramadan fasting in insulin-treated patients is associated with potentially unfavorable changes in glucose metrics. Those are the curves that we generated, fasting and non-fasting for Ramadan and non-Ramadan. And these are some of the important numbers from that particular study. 40 patients in the study, 13 type 1 and type 2 diabetes 27. HbA1c around 7 to 8%. And in this study, we looked at various metrics, including time in hyperglycemia level 1 and level 2, compared pre-Ramadan with Ramadan and post-Ramadan. And there you can see that time in hyperglycemia at both levels was quite significantly higher during Ramadan compared to the pre-Ramadan and post-Ramadan periods. What about time in hypoglycemia? Funny enough, in this particular study, what we found was that the percentage time in hypoglycemia range was actually less in the group that we studied. That is not generalizable to all other populations who practice Ramadan fasting. We know that that is not the case, but in this particular study, in a control setting, time in hypoglycemia was actually less during Ramadan fasting. Okay. Should we be adopting the time in range concept in Ramadan? Question 11, what time in range target is most appropriate for patients with diabetes during Ramadan fasting hours? So more than 70% was the answer that we just put to the respondents. So 68% of the respondents thought that that should be the target, and that is similar to non-fasting days. And the target of 60%, 23% of the respondents, target of 80%, about 7% of the respondents. Okay, so most agreed that the target should be the same as non-Ramadan days. What about time above range? What should the threshold be during fasting hours? During fasting hours, so less than 25%, which is similar to non-fasting days, 75% of our respondents thought that should be adopted. What about time above range for eating hours? So here, again, around nearly 70% of our respondents thought it should be similar to the threshold for non-Ramadan, non-fasting days, less than 25%. Was there any concern from the respondents about accuracy of hypoglycemia through CGM? So we had quite a mixed feeling about that. 31.6% were very concerned, moderately concerned 25%, 29.6% mildly concerned, 13.27%. So there was concern about accuracy of hypoglycemia by CGM during Ramadan fasting, and that's an important thing to note. Should time below range goals be stricter for fasting patients than for general population? So more than 50% thought yes. And what is the acceptable time below range threshold for fasting hours during Ramadan? 55% thought it should be less than 5%, similar to non-fasting days. 22%, 22.5% nearly thought it should be less than 3%. 22.5% again thought it should be less than 1%. So some about 44, 45% of our respondents thought that it should be more strict compared to non-Ramadan. What is the acceptable time below range threshold during Ramadan eating hours? So people thought it should be similar to non-Ramadan, most of them. And can we do better? Can CGM before Ramadan predict Ramadan fasting outcomes? And can we generate something like this for Ramadan? Can we actually come up with what thresholds should be? This is a study that we did some years ago, and this is the abstract from that study that was presented in one of the international meetings. I can't remember. But what we did was to look at pre-Ramadan CGM so we're looking to see if there's anything that can predict risk during Ramadan. And we found that the cutoff pre-fasting time below range of 2.5% provide a sensitivity and specificity of 0.84 and 0.83% for frequent hypoglycemia during Ramadan fasting. So the answer was certainly for hypoglycemia, we had a good marker there. In conclusion, most of the respondents seem to agree that desirable time in range during Ramadan fasting should not be different to non-Ramadan times. Time in range, most respondents agree it should be adopted for insulin-treated patients. Pre-Ramadan CGM can and probably should guide Ramadan risk stratification and management. And on that note, I thank you for your attention. And if there are any questions, I will be there to answer. Thank you.